Good morning. It's Thursday, October 28th. Welcome to The Doctor Is In, Ask Dr. Arwady. I'm Sybil Madison, Mayor Lightfoot's Chief of Staff, here with Dr. Allison Arwady.
Good morning. So nice to be with you and with you.
I love being here when I can. You know that Dr. Arwady is our Commissioner for the Chicago Department of Public Health. This is where you can get all your questions answered about COVID-19 and vaccines. And we're happy to take those questions through Facebook or Twitter using the hashtag AskDrArwady. So our space seems okay if we lean back a little bit.
Good.
Both fully vaccinated.
Absolutely.
With boosters, I believe.
Yep.
So why don't I turn it over to you to get into the data, and then we've got lots of good questions
We do.
today.
And thanks. People have been sending in really good questions, particularly about boosters. So we're going to try to get through a lot of them quickly. Go ahead and start putting them in the chat. We'll take a quick look at the data dashboard, chi.gov/COVID-. You can see the data continues to look good. We're still hovering under 300 cases. We got to get under 200 to get to the point where we can take the masks off per CDC, the recommendation for the indoor mask. And, you know, the governor's order also remains in place related to masking in indoor places. But generally, I'm happy with this. Hospitalizations are down. Deaths are coming down, still between 3 and 4, but a little lower. Vaccinations have been coming up, which I've been pleased to see. Testing looks really good. Our positivity is at 1.6%. And let me just pull up a couple of quick slides here. Sorry, there we go. So where we put this on our matrix, you see that the cases, we still remain in that substantial transmission range. Our positivity is great. That's partly because there's a lot of testing happening. Less than 2% is where I want it to stay. And we have capacity in both our hospital non-ICU and our ICU beds right now. Quick reminder, so we start from the same place on the booster conversation. For anybody who got Pfizer or Moderna vaccines for your first and second doses, you're eligible for a booster shot 6 months after your second dose. And the people who are eligible are anybody over the age of 65, and then anybody over the age of 18 who has an underlying medical condition, who is working or living in a higher risk setting, who's in a long-term care. We are especially focused on people who are over 65 or who are older, over 50 with underlying conditions. Really want those folks to get that booster shot. For people who are younger, it depends a little bit. You know, I have a little bit of underlying conditions, nothing that serious. I also see patients. I also obviously am out and about a lot. I went ahead and got my booster. For those who got a J&J vaccine, that would have been 1 dose. A second dose, a booster shot, is recommended for everyone 18 and older. So different than the Pfizer and Moderna, which are a little more, you know, extra focused on the older people. Really, for J&J, the recommendation is to get a second shot, actually. So in that case, the recommendation is for 2 months after getting that J&J vaccine. And as we talked a little bit on Tuesday, there is approval for what's called mix and match, where if people got a Pfizer or Moderna vaccine, can they switch and get something different for their booster? Yes, they can, and you know, and vice versa. Really, where we look at the data, the main difference between J&J and Pfizer and Moderna is that J&J was 1 shot. I still tell people, if you're going to get 1 shot, J&J is the way to go. 1 shot of J&J is more protective than 1 shot of Moderna or Pfizer. But Moderna and Pfizer, the first vaccine series, was 2 doses. So I hope that makes sense. For people who got a J&J, if it were me, where I look at the data, depending on the reason why you chose to get J&J, I would probably get a Moderna or a Pfizer as my booster dose. We see a little bit of a higher level of that antibody protection. Other than that, I don't think there's a lot of difference. So I got Pfizer first, I got a Pfizer booster, and we're happy to take other questions, but I just wanted to lay that out. Where do you get a booster dose? There is plenty. Plenty across providers, doctors' offices, hospitals, pharmacies. We have it available on our buses, at our pop-up clinics, etc. There's literally hundreds of places. And as of this week, our Pfizer and J&J booster doses are at all of the CDPH events, and we started offering them through Protect Chicago at Home. That's really especially for people who have barriers, right? If it's hard for people to get out, etc., we will bring boosters. But I want to note that booster doses do not qualify qualify for incentive programs like the $100 gift card promotion. Our top priority, and we do save at-home slots for people getting their first and second doses, and that remains the top priority. I also just wanted to give a shout out to the fact that the 2022 budget has passed. I'll refer you to the website if you want to read some more about that. Some really nice investments for a lot of the important work that public health is doing. Directly, we already had a lot of funding directly for COVID, but this is supporting a lot of the indirect effects, a lot of the mental health, substance use, violence prevention work. It's letting us expand our newborn home visiting program. It's letting us do more investment for lead poisoning prevention and much more. So that was a really exciting thing to pass yesterday, and just wanted to call it out and say hello. And then finally, we've shared previously some recommendations for staying safe this Hello weekend. And so, there's specifics on here about safer trick-or-treating, and I will refer you to halloweek.chicago.org if you want to read the details here. So with that, let's turn to questions, and I'm guessing there will be lots of booster questions among there, and we're happy to take them.
Why don't we start with the booster questions?
Sounds good.
Okay. Don Alley from Facebook. Is the Moderna booster recommended if someone received Moderna for the first 2 shots, or would it be better to get Pfizer for more coverage? Asking for a 73-year-old with underlying conditions and a 40-year-old.
Okay, good. So what I've been telling people, the reason for the mix and match approach is as much about access as it is efficacy. So before there was this mix and match approach, Pfizer was the only one that had a booster approved. And I'll tell you, for example, many people in long-term care facilities here in Chicago had gotten Moderna as those first doses, and we couldn't give them a Pfizer booster. And I was worried about that because that's one of our highest risk settings. So one of the ideas of the mix and match is that if you're somewhere and there's only, you got Moderna and there's only Pfizer available, you got Pfizer and there's Moderna, you got J&J, you are able to mix them. I would really ask how folks did with those first 2 doses. If you did fine, I would stick with the same one. The Moderna booster is the only one that actually is a slightly lower dose for the booster. And the reason for that is that the Moderna original vaccines were actually a slightly higher dose of mRNA than the original Pfizer was. And so the Pfizer booster is the same, whereas for people who got Moderna, the booster dose is actually a half dose. But I personally, it doesn't make a lot of difference. I would recommend sticking with what you received previously, and with the only thing there that if J&J was your first one, if you chose J&J because you were particularly concerned about side effects, that is the one that has had the least side effects, stick with the J&J. Getting that second dose of J&J also raises your immunity well. It goes a little higher with the other 2, but the most important thing is that if there are people who you are in close contact with in your network who have not yet gotten any vaccine, actually conversations with them about getting their first and second dose is even more important than anything you're going to do around boosters. So, the 73-year-old, definitely, I would recommend a booster. I would just probably go with Moderna again if that went fine the last time around, but feel free to do the others. And for the 40-year-old, similarly, we didn't see a lot of difference between kind of that Moderna-Pfizer split.
Yeah, that's interesting because it's making me remember that the Pfizer needed the ultra cold.
Yeah.
And the Moderna didn't, and so there were different places that you could get
exactly. That's
vaccines.
right. That's right. That's why we used Moderna at the long-term care early on, because we really wanted to make sure there was good availability in that setting. We didn't want some of those supply chain issues weighing in. But all 3 vaccines, just to be clear, continue to protect really well, especially against the hospitalization and death. It's just where we are seeing breakthroughs, it tends to be people who are older. It tends to be people with underlying conditions. We still have a lot of unvaccinated people here.
Yeah. All right. Cleo Kling from Facebook. Do I have to check my antibodies first before taking a booster shot? I'm done with both Pfizer vaccines 6 months ago.
Okay, very good question. No. And in fact, nobody needs to check antibody levels. I have never checked antibody levels. There is no antibody level that has been an agreed upon this is a level of protection. And that has to do with the fact that there are different antibodies, there's differences with timing. The scientists are still working. I would like nothing more than a blood test that says on an individual level, you have enough protection. There are some vaccines that we've been able to create, what's called a titer for. So measles, you can get your blood drawn, like, you know, as a healthcare worker, when you go and work in a new hospital, they basically make you get your blood drawn and make sure your titer, your antibody level, is high enough that you have protection. They make you get a booster, actually, if you're not. But there are some viruses we've never been able to get an actual titer for. And at this point, there is no individual antibody level that you say, you know, at this point, an individual is protected. And so, we use antibody tests to sort of understand what's happening at the population level, and that's been important. We use antibody tests when we're looking at vaccines and you know, generally speaking, what do protection levels look like. But for an individual, there is not a test, and there would not be any contraindication no matter what your antibody level is. So no need to get an antibody level. And occasionally someone will be like, did I have COVID before? I don't know. But some people who had COVID don't have detectable antibody levels also. So it's not a one-to-one, and I don't want people thinking because I have antibodies, I can't get COVID. That's also not the way it works. People who have had both recovered from COVID and had a COVID vaccine have the best protection of anybody out there. Next, I would say people who have the vaccine, but were lucky enough not to get COVID. Next, people who have had COVID, but did not have the vaccine. And then my biggest concern are the still almost 750,000 people in Chicago, we estimate, who neither recovered from COVID nor have had a vaccine. So that's kind of the order. But no need to check antibodies and no approved individual test for antibodies.
All right. Eugene from Twitter. If the qualified patient received a second dose of Pfizer Moderna after 5 months from the first dose, currently, according to CDC, patient considered to be fully vaccinated, when can they get a booster shot? Will they have to wait for 6 months for the second dose?
Okay, yeah, good question. So this person, it sounds like, waited longer between the first and the second doses.
Yes.
So, you know, the recommendation is you get your first dose and then you get your second dose, depending on the vaccine, you know, 3 weeks later, for example. So you still, in this case, want to get a booster if you are eligible for it 6 months after the second dose. And the reason is that every time the idea of this spacing is that it's sort of refreshing your immune system. And there are a lot of vaccines that actually work like this, where for some of the regular childhood vaccines, you don't just give it once, right? Like for HPV, you'll give it at the beginning, you know, and then you actually get it's not really a booster, it's the end of the series 6 months later. And that's because your immune system actually wants to have some time to kind of have come down a little bit from that initial immunity level, and you have this additional sort of refresher course for your system. And so, yeah, I would still wait the 6 months, and you are considered fully vaccinated, as you know, even if there was more space between the first and second. But it is critical. Anybody who didn't get their second dose of Pfizer or Moderna, please do that. You are not fully vaccinated until you are, and you're not as well off as people. You know, one J&J is still the best. Potentially, if J&J had been 2 shots from the beginning, it might have been a different story all the way along.
Right. Okay. Susan Villanueva from Facebook. When does one who had a breakthrough infection get a booster?
All right, good
That's
question.
An interesting question.
Yep. So there is no time that you need to wait after getting a breakthrough infection to get a booster, assuming that you are through that breakthrough infection time. So whenever you are diagnosed with COVID, whether it's you've never been vaccinated, doesn't matter, you get COVID, or it's a breakthrough, you still need to isolate for 10 days, okay? Minimum, and your symptoms need to be better. So as long as it's been at least 10 days, you're feeling fine, you can go ahead and get a booster at that point. The only time you would need to wait is if you're treated with monoclonal antibodies. And that's when you're actually at high risk for bad outcomes from COVID, you get an infusion, typically an IV infusion, to try to help keep you out of the hospital. In that setting, they recommend waiting the 90 days. But otherwise, you don't need to wait, and you could get a booster. You should also, not that I want you to have had COVID breakthrough, but you should know that having that has actually also increased your immunity.
Got it. All right, Deb Beasley from Facebook. I'll be going for my booster soon, but I'm hearing a 4th shot maybe in the future. What gives? And is this out of an abundance of caution or hogwash?
All right, you're the first one to ask that question, but I was guessing it might come up. So let me be super clear about this. There is a small group of people in the US who are what we call moderately or severely immunocompromised. Less than 1% of people in the US. So this is not like, I have diabetes and my immune system is a little off. These are people who are on medications specifically to suppress their immune system. They're getting chemotherapy. They've gotten an organ transplant. They have some sort of primary problem with their immune system. They definitely see specialist doctors about this. They see an oncologist, a cancer doctor. They see a rheumatologist. They see a immunologist, for example. And those people are at very high risk for bad outcomes from COVID, just like they are for bad outcomes from any other infection. And so even before we started talking about quote unquote boosters, before that Pfizer booster was approved, there were studies in this group that showed, yes, of course they should get a vaccine. You want to do everything you can to protect. But because many of these folks are literally taking medicines to tamp down their immune system because they have these hyperinflammatory problems, or they're trying to treat a cancer, the vaccine is not as protective. It's not that they can't get the vaccine. They get the vaccine, but their antibody levels are not high enough. And so a 3rd dose of vaccine was being recommended for those people with the severe immunocompromise. That one technically sort of wasn't a booster per se, but it was to complete the original series. CDC has now clarified for those folks that if they got their third dose, they too can get a booster, in 6 months, but it would be 4 months. In 6 months, which would technically be a 4th dose. But this is not most of you. You will know if you are in this category. If you're in doubt, talk to your doctor. And we really want anybody who is on these serious medications talking to their doctor, because also sometimes there are recommendations for pausing a medication or timing a medication that people take once a week around when they're getting a vaccine. So if you fall in that category, it is not most of you, you'll know it. Please talk to your doctor. They will have specific advice around that. And because it is 3 doses to be considered done for that first group, that primary series, that 4th is kind of the booster for them. But for the general public, no, we do not have 4th boosters on the horizon. And I hope that helps clarify.
All right. Thanks, Deb. Here's a nice shout out from Jennifer Ross from Facebook. You've got the original team back. Hi, Sybil. Hi, Jennifer. Yes. Always glad to be back here with Dr. Arwady.
Yes.
Yeah. Okay, we're going to switch over to kids vaccine. Lakeisha from Facebook. Once it's approved for 5 to 11-year-olds to get the Pfizer vaccine, what role will CDPH play with the vaccination?
Sure. So on Tuesday afternoon, we actually did a press conference about planning for 5 to 11-year-olds, and also Pedro Martinez, the CEO from CPS, was there too, talking specifically about some of the plans that CPS has around that. Let me just maybe take a step back and let folks know that the advisory panel to the FDA did vote unanimously, gave a green light recommendation for moving ahead with 5 to 11-year-olds. The FDA will weigh in on that formally. And right now, next Monday and Tuesday, the Advisory Committee on Immunization Practices, the advisory group to the CDC, is scheduled to meet to start vaccinating 5 to 11-year-olds. Both the FDA and the CDC have to give it the thumbs up. I expect that will happen. And so I expect that potentially as soon as late next week, we may be able to start vaccinating 5 to 11-year-olds. And that's with Pfizer vaccine only. It is a dose that is a 3rd the dose of what would be given to the older teenagers or the adults. And we have already done an enormous amount of planning around this. We have already surveyed all of the pediatric offices, all the federally qualified health centers, the family practices about how much vaccine they might need when. This is not going to be like the Hunger Games. There are about 210,000 5 to 11-year-olds in the city of Chicago. We are getting almost 100,000 pediatric doses that very first week.
Wow.
I would love to use 100,000 doses in the first week. It's not going to happen. But there will be vaccine widely available at especially some of those larger pediatric offices. That first week, we're only dispersing in 300 doses, so we're doing some larger places. Pharmacies are going to have it. All the Walgreens are going to have it. The CVS's and the Marianos and the Walmarts and the Rite Aids, you name it, like they're all approved for and receiving some vaccine that first week. Some of our children's hospitals and other hospitals are standing up some things right from the beginning. Lurie Children's, Comer Children's, St. Anthony's, probably some more. Nobody's been able to officially announce the timing because we need to have that approval first. But as soon as that very first weekend, there will be plenty of opportunities to get vaccinated. CDPH has been planning, again, not knowing exactly the timing, starting the next weekend. So that would be the, 13th, whatever that is, that weekend, that sort of Saturday, Sunday. We're going to do, like we did for the adults, we'll be doing a series of weekend clinics in partnership with city colleges. So we'll be at city colleges around the city, a different one each weekend. We're going to skip the weekend of Thanksgiving because I'd like to give my staff at least one holiday off in 2 years. And other than that, really planning one a week, probably into January. We'll have kid vaccines available. We'll have adult COVID vaccines available. We'll have boosters available. We also, beginning the 15th, are planning to have 5 to 11 child vaccines available through any of the events, et cetera, that we'll be doing. And then schools are doing extra work. Schools especially, we're focused on where there may be more barriers for parents to bring kids in. Are there opportunities to sign consents and do, vaccine-focused visits at schools? We've been doing a lot of planning with CPS. They certainly will have vaccine available at their regional clinics, and they have some mobile clinics, et cetera. But also where we see some lower vaccination rates at schools, there's going to be an ongoing campaign there. But the first few weeks is to make sure that people who are really excited to get that vaccine can get it without a lot of barriers. And I'm confident you're not going to have a lot of problem getting a vaccine.
All right. And does this, does the kid sized portion, it still needs to be stored in the same way with the ultra cold?
Not ultra cold anymore. So so Pfizer has managed, as we've made progress here, we don't need to have the ultra cold, which has made a huge difference because, pediatric offices are very used to, of course, handling the vaccines, but not the ultra cold. So no ultra cold needed. And, there's specific timelines. You can have 10 weeks. Once you puncture a vial, you do need to use it within hours. And so that is not different from what we do for the adults and the kids. But yeah, no ultra cold available.
The storage was such a logistical issue.
The storage was such a logistical issue, and now it's the regular storage, and you can have 10 weeks to use it. So that's good.
That's great.
Yeah.
All right, here we go from Erica RPH Farm D. So I think maybe Dr. Erica from Twitter. Will there be any different pediatric vaccine distribution model pending vaccine approval? Pharmacies are overwhelmed as it is, and pediatric vaccination can involve nuances that may be better handled in a pediatrician's office.
Yeah, thanks for that question. So I agree with you that the number one place we would like children to be vaccinated is with their pediatrician for a whole host of reasons.
And isn't that usually where most kids get vaccinated?
That's the number one reason.
Okay.
Yes, exactly. No, that's perfect. Yes. Because, yes, in pharmacies, pharmacists and pharmacy techs, they are able to vaccinate children all the way down to the age of 3. So you are able to get your child vaccinated. But pediatric offices have a lot of experience, like a ton of experience with, vaccinating children.
Yes.
And, where children, sometimes young children, can be afraid of shots. And, they're very good at vaccinating children. But also, they know your child, they know your family. Are there other vaccines that your child may be behind on? Has your child had the flu shot? Couldn't we maybe just get them both done at the same time? Can we make sure the records are up to date? Do you have other questions? Are there other family members? Really, especially for kids, we would love them to get vaccinated in those pediatric offices. And many of the larger pediatricians and the federally qualified health centers are standing up some extra availability for their own patients, but also for others. We know that not all families are connected to pediatric offices, although all children are eligible to be seen, just to be very clear. Even if parents do not have insurance, if there's documentation issues, every child has the right, and there is funding available for that child to get primary care. And I would refer you to your community health clinic, your federally qualified health center, if you're not sure about that. But one of the good things, children are much less likely to get seriously ill from all diseases, and they're a lot cheaper to insure. And so the government does make sure that all children, regardless of background, regardless of anything, can access the medical care that they need. But also, we want to make it possible for people to get vaccine in ways that make sense for them. So one of the reasons we're standing up weekend clinics is that, pediatric offices are rarely open on a Sunday, right? We know people are working at different times, and especially for those younger kids, often a parent is going to want to be present with that child. So I hope that answers it. I do think, Walgreens is taking 12,000 vaccines just that first week. We do expect a lot of people to probably get vaccine through those pharmacies. And I want to thank all the pharmacists, like you, for your work in doing this. It's been really critical to have pharmacies be a part of this. But I agree with you that where people are connected to a pediatric provider, that is the preferred place.
Yeah. It's making me remember that through COVID, this became an opportunity to connect people to care who weren't connected.
Yeah, and that's one of the things with CPS we're especially interested in, right? Like where there are kids who don't have a medical home, yes, I want to get them vaccinated. More than that, I want to make sure they're getting signed up for the programs that cover their health care free of charge, right? If they're in a lower income family. I want them connected to a health clinic. I want to make sure they're getting their dental and they're getting their routine, all of that work. And so, yes, I want to get vaccinated, but some of the goal of having children move to medical homes, it's because in the long term, that's even more important for them.
Yeah, and I believe you can go to www.hrsa.gov to find the federally qualified health center near you.
You can.
And that health center will take you regardless of your ability to pay.
Yeah, and there's 15 or 16 school-based health centers also that typically in CPS anyway, the federally qualified health centers actually operate within the schools to provide care for students, to provide care for families, in some cases to provide care for the community. Really some nice overlap there. So lots of good work happening around really thinking about how to reach not just those students, but parents, grandparents, and it's going to be probably our last really big push for vaccination.
Yeah. All right, here's a word problem from Fay State. Okay, pay attention.
I'm paying attention.
You got to follow this. If an 11-year-old child has the first vaccine before their 12th birthday and then gets the second vaccine 3 weeks later when 12, which shot would the child get for the second shot? The one given to the 5 to 11-year-old or the one to give to 12 plus?
Yeah, all right. So I actually know the answer to that. So in all cases, just as a reminder, all children under 18, they get Pfizer. So we're talking about the difference between the child size, 1/3, and the teen and adult size. This is not weight-based dosing, to be clear. This is age-based, based on sort of how developed an the immune system is. It has something to do with body mass, et cetera, but it's not like my child is a very large 11-year-old or a very small 12-year-old. You got to kind of draw that line somewhere. There is actually, ACIP, when they put out the formal guidance on this with CDC, will probably weigh in on this in some detail. I expect we're going to see about a 4-day window around that 12-year-old birthday, probably. If your child is really close, the official answer there is if you really want to start, they would actually get the smaller dose when they're 11 and they would get the larger dose when they're 12. If you want to wait a few days and have them get both when they're 12, that's fine. But they will need 2 vaccines, and I would, if you're really wondering about it, you can also talk to their pediatrician and see what the thought is. But technically, if you're before 12, smaller dose. If you're after 12, over 12, larger dose. And if you want to wait a week for a child's birthday, be my guest.
All right. Cindy Sliwa from Facebook, you might have mentioned this before, but do you have any information on boosters for the homebound?
Yes. So boosters for the homebound are available. So through Protect Chicago at Home, you can call 312-746-4835. That's the same number that you call if you have a question about your booster, if you want to know where near you has a booster available, if you never got your second dose and where you're supposed to go, you know, no matter what your question is, we continue to staff that line 7 days a week. We get lots of questions. We want nothing more than to help answer your questions and solve your logistic questions. And we did, as of this week, open up, especially for people who are homebound, the at-home option for booster shots. Now, I want to be clear that we do not have unlimited capacity for that, and we continue to reserve slots, especially for people getting that first and second dose, which is the most important. So I can't guarantee that you'll be able to call and get it, tomorrow, but we will definitely, especially if you're homebound, we'll get you scheduled. And we did see quite an increase when we opened there. So we know this is meeting a need, people who were otherwise unable to get it. You cannot get an incentive for a booster dose. So we don't provide any of the gift cards with that, but certainly if you're homebound, we're happy to help solve that particular problem.
Awesome. And it reminds me that we have just a wonderful group of contact tracers who have flexed this whole time, and they work that line when people call in. And
today is the 1-year anniversary of the first day they actually started contact tracing. They were training before that, but I was on with them yesterday, like hundreds of them, and I just love that group. Like, it's one of the things Chicago has done so differently than almost anywhere else. So many places, contracted with a call center in North Carolina or an academic center. And we basically said, this is probably going to be a thing. And we're worried about our community-based organizations. We're worried about trust. We're worried about, and we're going to do this a way that is harder up front, but more important in the long term. And we put out a request for proposals. Chicago Cook Workforce Partnership won that. And then in turn, we've got more than 30 community-based organizations across the west and south side who each hired people who started, who didn't have any public health training in most cases. We did an earn as you learn, worked with city colleges, and have seen, hundreds of these folks start out with contact tracing and just be so amazing and flexible, and have, then we went into how do we connect people who have COVID to the other things that they need, and really resource hub and quarantine and isolation. They've done the door knocking where we're in under-vaccinated areas. They now not just, those are the folks who answer the phone. When you're calling in and scheduling your at home, that's who's doing that. We're also calling out. We call people who we know who are not showing up as unvaccinated but are in our highest risk Medicaid or Medicare lists, or who families who are at schools that are highly unvaccinated, and we're wanting to make sure that guardians are getting that information. So it's been really amazing. The coordinator from CDPH is named Patrick Stonehouse. Lots and lots of partners involved in this. And then I just couldn't be more proud. And a lot of the work of this group is the kind of work that we want to really continue post-COVID. This very community-based, when you're not in an outbreak, what are we doing to actually make sure people are connected to social and health services? What are we doing on chronic disease issues? How do we build this really neighborhood-based infrastructure that then can also pivot? I see it as really part of preparedness. So yes, happy anniversary to all of you.
Yeah, and some of those folks have moved on to other jobs. You mentioned the earn and learn. This has been an opportunity for them to kind of progress.
I've been so pleased by it, and I can't thank those folks and the organizations and the many supporting groups. We've got this whole core of people who really care about public health and care about protecting people in Chicago, and have been really wonderful.
All right. MLC from Twitter. The thinking seems to be that cases are going to likely go up over the holidays. But we've also heard that the hope is that the mask mandate will be lifted before Thanksgiving. Those two things seem to contradict each other. Can you comment on that?
I can comment on that. So the CDC recommends strongly that whenever a jurisdiction is in substantial or high transmission, that masks are worn in indoor settings. And that is just because of that, it's a math problem. It's how likely are you to run into somebody who has COVID and doesn't know it. And so the way that that is calculated is there enough testing going on? What is your percent positivity? If your percent positivity is just fine, like ours is, you then are looking at the, because you can also be in substantial or high purely if you're not testing enough.
Yeah.
But assuming your testing is good, like ours is, you look at the number of cases that are being diagnosed each day. CDC actually calculates it on a population basis per week. It works out to the same numbers approximately that we have been using all along here. So when we have more than 400 cases per day of COVID in Chicago with adequate testing, which we have, we are in high risk from a COVID standpoint. When we have over 200 cases, we are in substantial risk. As we move under that, we get to a moderate risk, and then there's a low risk. And when we were on the way up with the Delta surge, when we crossed the 200 mark, said we recommend that people put masks back on in the indoor setting. We put the mandate on over 400. But then CDC, because of the Delta surge and how much more contagious it is, really said substantial or high, keep those masks on indoors. So I'm just watching our numbers. We're sitting at 290 something, like I showed you. I've been talking with the state. Everybody is in agreement that if and when we get back down to under that 200 cases per day mark with adequate testing, and we can stay there, not that long, but if we can stay there, it will come off. And Illinois is doing much better than all of the states around us from a COVID perspective. That's not an accident. And I have no intention of changing what we've been doing all along, which is sticking to the best evidence that we have, the things that have allowed us to stay open. I am so happy to be able to be going back to the theater, to be going back to indoor games, to be able to do all of those things. Right now, masks are a part of that. I know the governor said the other day he's hoping to potentially be in a place where masks can come off by the holidays. I didn't hear anything about Thanksgiving specifically. If we're there by Thanksgiving, yeah. And frankly, the ability for 5 to 11-year-olds to get vaccinated also helps a large population that has not yet had the ability to be protected get protected. But what I would expect, we are worried because in Michigan and Minnesota and a lot of northern states, cases are already on the rise. We've not seen that at this point. And I want things to stay open. That's like the top goal. I don't want to have to be cutting capacity. I don't want to have to be dialing back on things. Obviously, schools, all of these things. Masks are a part of that right now. We get back down to where we were over the summer, I'll be the first one to say we're out of that substantial risk territory. But that's where we are. So I'm hopeful, if things can stay good and people continue to do the things that help us get protected, especially get vaccinated, then we would potentially be there. But I think some of that is where you're hearing some of the maybe state versus city piece. There is still a statewide indoor mask mandate in place. And behind the scenes, I've had plenty of conversations, and everybody is in agreement that if we can come out of that substantial risk territory, just like all over the country, we would remove that requirement.
All right. Well, it seems like a good goal to get your kiddos vaccinated before Thanksgiving.
Yeah. Can I just say one other thing, actually, on the getting your kiddos vaccinated point, because I don't know if anybody, but somebody asked me this yesterday, and I thought it was a good one. Another really good reason for children to get vaccinated is that vaccinated children do not have to quarantine if there is a case in their school classroom, unless they get symptoms, et cetera, et cetera. And so where we know how disruptive, right, this has been to adults' lives, et cetera, one of the goals, the first goal, of course, is to prevent COVID, but like in terms of having less breakup of schools, et cetera, and you know, less break in learning, when your child is vaccinated, their risk is so much lower that per the CDC, per all recommendations, children do not need to quarantine, even if there has been a case and a potential exposure. We need to watch them for symptoms or some other things, but they can continue attending school. So that's another good reason to get your child vaccinated in terms of less disruption to hopefully their improved academic routine back in school.
Lots of benefits.
Lots of benefits.
All right. Well, we are at time,
Okay.
Dr. Arwady. It's been so nice to be
It
with you
has
today.
been. Thank you for returning to our bi-weekly conversation about COVID.
Yeah.
So,
yeah.
yeah.
I guess you're back on Tuesday.
I am back on Tuesday. Yeah, we'll be back. We'll take more of your questions. If we didn't get to it today, we'll try to get to it Tuesday. Lots of good stuff coming in. So don't hesitate to send questions. It really helps me to see what people are wondering about, because sometimes the things I think people are wondering about are different than the things people are actually wondering about. And so I really like getting questions. There is no question. You know, I want to hear your questions, no matter what they are. Even if you're reading something and you're like, is that true? Or this seems really strange, please bring those to our attention, because I like to know what people are reading, especially if you're seeing something that doesn't seem to match what I'm saying. I'd love to talk about that and really tell you why, you know, put some more science behind the reasons why we share particular data.
All right. So until then, happy Halloween.
Happy Halloween.
ChicagoHalloween.org, and
Yes.
happy Dia de los Muertos, too.
Muy bien.
Yeah.
Thanks, everybody.